This is part 2 of the head-to-toe assessment for Nursing 383. I'm going to start here with the neck, so I'm just going to first inspect the neck for any masses, any scars, and the symmetry, and then I'm just going to quick feel it. And that's good. I'm now going to palpate the lymph nodes, the pre-auricular nodes, and the post-auricular nodes behind the ear, and then the occipital nodes at the base of the skull here, the tonsillar nodes under the jaw, submaxillary nodes along the jaw, the submental nodes right underneath the jaw, the anterior cervical along the trachea, and the posterior cervical right here. And then if I can just have you kind of like that, yeah. And then I'm looking for the supraclavicular nodes right there. Alright, I'm then going to feel both sides of the carotid pulses, one side at a time. And that's good. And then I'm going to inspect and palpate the trachea to be sure that it is midline. That's good. Yep. Alright, I'm then going to move to the upper extremities. So I can just have your hand here. I'm inspecting the hand and the arm and then the shoulders here on both sides. And I'm looking at the skin for any masses, I'm looking at the muscle mass, I'm looking for any lesions and any deformities there. I am then going to observe the range of motion of the hands, or of the upper extremities, so if you could just like wiggle your hands. Good. Okay, and then open your fingers and then like don't let me close them. Okay, so hold them open, don't let me close them. Okay, both sides, good, and then close them and then don't let me pull them apart. Okay. Okay, good. And now with your wrist, can you just rotate your wrist here? Okay, and then put your hands like this. Okay, don't let me push your hands back. Okay, and then don't let me pull your hands. Okay, good. Now we're going to go to the elbows here. Yep, good. And then, okay, put your elbows like this. Okay, don't let me pull. Okay, and don't let me push. Good. And then your shoulders. Go up like this, and then back down, and then in like this, and then out. Good. Okay, now I'm going to assess his radial and brachial pulses. So on your hands here. Assessing your radial pulses, and they are equal bilaterally, and then brachial pulses. Good, and then I'm going to palpate the epitrochial nodes on the inside of the elbows. And that is good, okay? I'm then going to assess the lungs and the thorax. I'm going to first inspect the respiratory efforts, so the rate, the rhythm, any retractions or signs of respiratory distress, looking for the symmetry of his breathing pattern, and then I'm going to move to the posterior aspect of it. So I'm first going to palpate, and I'm going to start way above here, way above the clavicle here. So on this side, and then from side to side, and down the two lung fields. Okay, good. And then I'm going to percuss, starting above the clavicle there, and comparing the two lung fields again. Okay, and then I'm going to auscultate with the diaphragm and my stethoscope. And up here I'm hearing bronchovesicular sounds. And as I move down, and as I move down, I heard vesicular lung sounds. I'm then going to move to the anterior aspect, and I'm going to palpate again starting way above here. I'm going to palpate throughout both lung fields here. And then I'm going to percuss. Alright, good. And then I'm going to auscultate again. I'm hearing bronchovesicular sounds there. And through the bronchial region, I heard bronchial lung sounds. And vesicular lung sounds downward from there. I'm then going to move to the cardiovascular aspect of the assessment. So I'm first going to inspect the carotid and apical pulses for any bounding or anything. So again, I'll assess the carotid pulses one side at a time. And then palpate the apical, the apex here, and then the base. And that is good. I'm then going to auscultate his heart sounds using the bell on my stethoscope, and if this patient had a murmur, it would be easier to hear that with the diaphragm. Alright, so I'm listening first to the apical, the pulmonic, the tricuspid, and the mitral valve. And I would do that in 3 different positions, sitting upright like he is, leaning forward, and then in a left lateral position as well. And then at this time I would do a breast and axilla assessment, but that will not be done at this time. Okay, we're then going to move to an abdominal assessment, so I'm actually going to have you lay down here. Okay, good. And first I'm going to inspect the abdomen for the contour, the symmetry, any hernias, masses, any lesions. I'm looking for peristalsis, any pulsations, and at the umbilicus there. So, and that all looks good. And then I'm going to have you really put your chin to your chest. Okay, and now I'm looking to see if there's any hernias or masses or muscle separation that's present when his chin's to the chest. Okay, you can relax from that. I'm then going to auscultate for bowel sounds with the diaphragm. I'm doing that in all 4 quadrants, and I heard normal bowel sounds and nothing abnormal there. So then I'm going to listen for the aortic and renal arteries with the bell. Just to the right of the umbilicus and slightly above. Okay, and that is good. I'm then going to percuss the abdomen, and I will hear tympany over any non-organs, and I hear dullness over any organs, stool, or a full bladder there. So I'm then going to have you take a deep breath for me, and I'm going to see if I can palpate your spleen, or your liver on your right side here, okay? Okay, good, that's good. And then your spleen on this side. A deep breath in and out. Alright, good. I'm then going to palpate the abdomen, first lightly. So trying to elicit any pain or feel any masses. And that's good. So then I'll move to a deeper palpation here. And no masses are present there. So I'm then going to feel for the inguinal nodes and the femoral pulses. I'm going to do that, and while he's laying here, I'm just going to jump to the hip part of the lower extremity assessment. So I'm just going to test strength and stability on both of your hips, and then we're going to test the range of motion of your legs here. So up, and then out, and then in, and we would do that on the other side as well. Okay? Then we're going to move to the lower extremities. So if you could just sit at the edge of the bed here. Alright, I'm first going to inspect the equal hair distribution, the muscle mass, and the skin color. And then I'm going to palpate for the temperature and any moisture. I'm going to assess for edema, pressing my thumb into the foot for 10 seconds, releasing, and that is good. There. I'm then going to look at range of motion, so if you can move your toes and your feet. Okay, good. And then rotate your ankles. Okay, good. And then your knees, bend them and then back. Okay, and then don't let me pull them or push them down. Okay, good. And then put them down here, and don't let me pull them forward. Okay, good. And I would do that on the other leg as well there. This whole time I'm looking for ease of muscle motion, symmetry of muscle movements, any deformities or atrophy that the patient may have there.